The January 2025 research article, Recovery Support Services as Part of the Continuum of Care for Alcohol or Drug Use Disorders by Ed Day, Laura Charlotte Pecci, Susie Roscoe, and John F. Kelly, strongly supports several foundational concepts underlying aging in recovery and the aging in recovery residential model. The study recognizes addiction not as an isolated event, but as a chronic condition requiring long-term management, community support, recovery capital, housing stability, employment support, peer engagement, continuing care, and recovery-oriented systems of care. This directly aligns with the core philosophy behind the aging in recovery residential model and the broader concept of recovery-informed aging services. Importantly, the authors acknowledge that remission and abstinence alone do not equal complete recovery. The article specifically references the concept of recovery capital, defined as the internal and external resources necessary for sustained recovery and human flourishing. That distinction is critical. In the Diagnostic and Statistical Manual of Mental Health Disorders, or the DMS-5 criteria, remission may simply mean that an individual no longer meets diagnostic thresholds for substance use disorder over a 12-month period. In practical clinical settings, this often translates into professionals considering relatively short periods of abstinence, 30 days, 90 days, 1 year, or even several years, as recovery success. However, the longitudinal realities of addiction demonstrate that abstinence and recovery are not necessarily the same phenomenon. The study itself notes that relapse risk remain elevated for years after cessation of substance use, and that it may take 4 to 5 years before risk levels approach those of the general population. That observation supports a major argument underlying aging and recovery. Recovery is not merely the interruption of substance use. Recovery is a prolonged developmental, behavioral, emotional, social, psychological, and often spiritual transformation that unfolds across decades. For more information, you should check out my video, The Difference Between Abstinence and Recovery. From the perspective of long-term recovery communities, particularly peer-led fellowships, recovery is not measured solely by the absence of substances. It is reflected in sustained lifestyle change, emotional regulation, accountability, rebuilding relationships, service to others, stability, community integration, and identity transformation over extended periods of time. A person may be abstinent, yet still psychologically, emotionally, socially, and behaviorally trapped within patterns associated with active addiction. This is one of the major limitations of many clinical research frameworks. The dominant treatment paradigm often focuses heavily on relapse prevention, remission rates, symptom reduction, treatment retention, overdose reduction, short-term abstinence outcomes. Those are important, but aging and recovery asks a different question. What happens after 10, 20, 30, 40, or even 50 years of sustained recovery? What happens when individuals who survived addiction decades earlier begin confronting aging, frailty, chronic illness, grief, cognitive decline, mobility limitations, and long-term care needs? The Day et al. Article indirectly supports this concern by emphasizing that recovery support services must extend far beyond acute treatment episodes and into long-term community-based support systems. The study repeatedly highlights recovery housing, peer support services, continuing care, recovery coaching, recovery community centers, employment supports, long-term monitoring, and support systems. These findings reinforce the argument that recovery is not a short clinical event, but a lifelong continuum requiring evolving systems of care. However, even this important 2025 review primarily focuses on relapse prevention, sustained remission, early recovery stabilization, engagement, and treatment systems. It still largely stops short of fully examining the aging-related realities of individuals with multiple decades of sustained recovery. That is where aging in recovery and the aging in recovery residential model attempt to extend the conversation. The emerging issue is no longer simply, can people stop using substances? Increasingly, the question becomes, what happens after they successfully remain in recovery for decades? And perhaps even more importantly, are our healthcare, aging, housing, home care, assisted living, and long-term care systems prepared for the growing population of older adults aging in long-term recovery? The aging in recovery residential model proposes that this population constitutes a distinct service population requiring recovery-informed home care, recovery-informed assisted living, recovery-informed workforce development, peer-informed aging services, recovery-sensitive care coordination, community integration supports, identity-preserving environments for older adults in recovery. The article by Day and colleagues helps lend legitimacy to this broader framework because it validates several central premises. 1. Addiction behaves as a chronic condition. 2. Recovery requires long-term support systems. 3. Recovery capital matters. 4. Peer-based systems are essential. 5. Stable housing and social support influence long-term outcomes. 6. Continuing care improves recovery sustainability. 7. Recovery extends beyond acute treatment episodes. But aging in recovery pushes the conversation further. It argues that true recovery is not merely temporary abstinence or symptom remission. Rather, recovery is an ongoing, lifelong process of transformation, adaptation, growth, accountability, and construction of identity that unfolds across the lifespan. And as increasing numbers of people now achieve 10, 20, 30, and 50 plus years of sustained abstinence and behavioral change, society must begin developing systems specifically designed for people aging in long-term recovery. That is the service gap that the aging in recovery residential model seeks to address. If you found this information valuable, feel free to like and subscribe for more insights. This has been Aging in Recovery. If this topic matters to you, please stay with us as we continue to explore this emerging field.